You ready? Okay. Yeah, just waiting for you all to give us the go ahead. All right, thank you. Good afternoon, everyone. And I'd like to first of all take this opportunity to welcome everyone on behalf of the members of the Orleans Parish School Board and NOLA Public Schools to our press conference for today. I want to start off this afternoon by just reminding everyone that the health and safety of our NOLA PS community continues to be our top priority as we continue to navigate COVID-19 here in our community. This is why I will say we made the tough decision to shift back to distance learning for the majority of our learners once we return from winter break. As promised, my team and our public health advisors have continued to track the data across multiple measures over the last 2 weeks to evaluate and understand where we are today. Based upon that review, here's what I can report today. We are seeing promising data, but in-person learning citywide at this time cannot resume. The citywide positivity rate has significantly declined since New Year, and I want to say that's very, very encouraging to us. However, when we look at the number of positive cases being reported, that number is still high. We're very thankful as I speak about the positive cases that the case count is now trending in the right direction, which is down. Given these key data metrics and our goal of prioritizing the health and safety of our students and staff, for now, we're going to keep our current distance model in place, and we'll continue to watch these metrics over the next week. Along with our medical advisors and city officials, in hopes of seeing the trend continue. We will update everyone next week, no later than January 28th, and I'm hoping to provide very good news at that time. If the recent data and the trends continue to hold, we will likely return to in-person learning citywide as we did before. But I want to remind everyone, when we did this before, we returned to in-person learning in a very measured way, prioritizing our youngest learners in pre-K through 8th grade first, and then phasing in our high school students. At this time, I'd like to take a moment to share my gratitude to our parents who have sacrificed so much to balance their lives around their children's education. I know the news today is very, very difficult to hear, and I thank you in advance for your continued patience and support as we work to do our part in keeping our school and our community safe. We are also very grateful for our teachers, our school leaders, and our school staff who have persevered to keep our students engaged each and every day. I know as we think about COVID-19 and we're going day by day, we don't realize that we've been in this moment for over 10 months. And so I have to applaud our educators, whether we were in person, whether we were actually home and distance learning as we are today, for continuing to stay focused on the education of our students. And we're so thankful for that. And of course, we cannot forget about our students. They are very resilient. And we all know as adults, we're facing COVID-19, but they are also navigating this virus in our community as young people. We're very thankful for the leadership and support from our board from the very onset of this virus and their continued support and leadership, again, as I said, now over 10 months as we navigate this virus in our community. And finally, to my leadership team. and the entire central staff for working day in and day out to support our schools. It's going to take all of us doing our part to beat this pandemic and get our students back in school, where we know they will receive the best educational experience. So please, I'm not going to say anything new, so please mask up, keep your social distance, wash your hands, get tested so that our students can get back to school in short order. Together, I know we can do this. And I promise to keep our community of schools and the public updated weekly through our constant communication, our COVID tracker, and the media as circumstances change. At this time, I'm going to ask my Chief Operating Officer, Tiffany Delcourt, to come up and speak about our latest efforts to track and curb COVID here in our community. Tiffany?
Thank you, Dr. Lewis. We continue to focus on evaluating the positive test rate and the number of new cases with our medical advisors and city officials as we consider when it is the right time to return to in-person learning. For the past 2 weeks, we have seen a significant decline in the city's positive test rate, and as of today, our positive test rate is 3.6%. This is incredibly encouraging and a clear sign that the restrictions put in place by the city of New Orleans have put us on the right path. We have also seen a decline in new cases over the past week and a half, with the city reporting a daily average of new cases today of 142. Though this downward trend is also encouraging, we need to continue to monitor this metric with the goal of having a prolonged and deeper decline in new cases. These reductions are hopeful signs, as Dr. Lewis said, but they're not quite where we need them to be in order to resume to in-person learning on a larger scale. Also, I'd like to point out that we're constantly reevaluating the metrics we use to track the spread of this pandemic that influence our decision-making. In consultation with our medical advisors, we have looked at how other states and educational institutions advise school systems to use health data to make decisions about in-person learning. And we proved this fall that what health and educational institutions concur with is that school is one of the safest places to be for students and staff when levels of COVID-19 in our community is low to moderate. When we evaluate data metrics, we will also evaluate multiple factors, such as trends in positive test rate, new cases, hospitalizations, and the availability of testing. We do not rely on a single metric to reach a single decision, but rather a combination of all of these factors and how they relate to one another to give us a best overall picture of community health over time. For example, multiple resources support that school can be fully open when the positive test rate is trending between 5 and 9%, as long as other metrics that we evaluate are trending at lower, safer levels. Should the current trends in positive test rate and new cases continue in a favorable downward direction, we will consider returning our lower grades to in-person learning. But we will remain highly vigilant to appropriately balance the benefits of in-person learning against the risk of COVID-19. Meanwhile, we continue to leverage our partnerships to launch even more ways to help curb the virus and protect our students and staff, especially through the availability of additional testing and at our school sites. Through our partnership with Children's Hospital, we are actively vaccinating our school nurses, other health care roles in schools, and those in our schools that are 70 years of age or older. As soon as we get the go-ahead from the state, we'll start vaccinating our teachers and staff, and we are actively planning on logistics with Children's Hospital on that work now. COVID testing is still available for students and staff through Children's and for Ochsner for our school-based staff. Please contact your school nurses for more details or visit our website at nolapublicschools.com. We encourage everyone to get tested regularly and let your school know when you're sick so they can connect you to these valuable resources. So again, we encourage everyone to do their part to stay safe so that we can get our students back in school as soon as possible. Now I'd like to invite one of our medical advisors, Dr. Ryan Pasternak of LSU Health Sciences, to share his perspective.
Thank you, Tiffany. Dr. Lewis, you said it well. We like the direction of the metrics, but we want to see those trends hold up over the next few days. Our positivity rate is indeed in a much better position, and the new case count is heading in the right direction, but we're not yet at a point where we're ready to return all students to in-person learning citywide. As Tiffany said, and in my role with Dr. Ben Springate as the district's medical advisors, our work is to take all these data points and aid the district in analyzing them into a full picture of our current community's health. This way, the district can make the best decisions at the best time for its students and its staff. Therefore, no one metric will drive a decision for the district. And we have learned some metrics can be acceptable at higher levels if other data are trending lower. In the end, though, we all play a vital part in shaping these data trends too. So please continue wearing masks, practicing social distancing, washing your hands, and avoid social gatherings. And please continue to get tested. NOLA Public Schools and the New Orleans community have done a great job holding to the well-developed plans and the roadmap to reopening. It's a major reason why community spread in NOLA Public Schools isn't prevalent. So for all of us, let's keep that going. I'll now turn it back to Dr. Lewis and Ms. Delcourt for any questions you may have.
Coughlin. Yeah, I'm going to ask Tiffany to come up, but right now in our school system, as it has been mentioned, our school nurses have been the first ones to be inoculated. We're very excited about the opportunity when we move to the next phase for our educators, but I'll let Tiffany come up to give you those exact numbers on the number of nurses that has been vaccinated at this time.
We don't have the exact number of how many people have been vaccinated, but we do know approximately 330 individuals in our school system have been scheduled for vaccinations through Children's Hospital, and we continue to track that over time as they register, schedule, and then vaccinate those individuals.
And lastly, you've referenced a few studies that show if COVID rates are low within a city, it doesn't look like community spread can happen within the schools. With that in mind, why not just open schools or return back to in-person learning?
Again, we look at multiple factors. So we know that our positive test rate is really low and exactly where we want it to be. New cases aren't yet there, and we want to make sure that it's part of a trend. Our new cases have been declining for the past week and a half. We'd like that for it to be a full 2-week trend before we make any substantial decisions.
Afternoon. If you guys could just tell us a little more about the data that caused you all to go back to virtual learning or to continue virtual learning.
Yes, and I know Tiffany is going to come right back up, but what I will first of all say before Ms. Delcourt come up, I want to take everyone back to the very beginning. Last summer, we created a roadmap to reopening that really guided us through how we would navigate COVID-19 in our community. And when we were preparing for winter break, we shared with our school community to be prepared just in case when we return, those numbers will spike so that we can pivot to distance learning, which unfortunately we had to end up doing that. But I also will say, as we immediately started to return, those numbers, and Tiffany is going to come up and share some more information, but those numbers each day and all the metrics we had were really going off the chart, which really actually had us to make the right decision at that moment to return to in-person learning for the majority of our learners. I'm not sure if you want to add any additional information, Tiffany.
Yeah, so Dr. Lewis really just kind of hit it what we were looking at. I think the things that I could add is kind of how we've talked about this decision to return to in-person learning. What we saw in early January were two key metrics rising in unison and quite significantly at the same period of time, which really indicated there was a massive change happening in the level of community spread and at the same time. And so that was a key indicator to us that there was something really unique happening that required urgent action.
And just where would the city need to be exactly in terms of actually bringing students back in class when it comes to data? Where exactly do we need to be?
Yeah, so it's not exact data metrics, not exact numbers. It's really about trends. It's really about trends and that them being prolonged and on the right direction. We've seen the significant trend in positive test rate. It is below 5%, which is a great place. Our new cases have not been declining as much and for as long as a period of time. So I want to give it more time to make sure that that trend is as long lasting as we're seeing in our positive test rate.
How much longer would you say? Like,
We want to see until we get to next week.
Hi, Dr. Lewis.
Hi.
I know you guys are making an effort throughout this closure to have students in the classroom where you potentially could. Could you give us an idea of how many students are in those small settings in classrooms right now, or which programs are offering that?
Yes, at this time we have a few schools. I don't have that information with me at this time, but what I want to say is this. When we made the decision to transition back to in-person learning, and especially we know that for some of our most vulnerable students, where our schools have been able to meet the needs and been able to have them to come in person, they're making those things happen. We can follow up after with more detailed information, but the main point I want to make is that even though the majority of our students are home on distance learning, our schools have been able to provide in some small settings to support our students, and that's some of our most needed students.
My next question is probably for Tiffany. I was curious which vendor is providing the on-site testing services that you guys are offering now?
We're working with the Louisiana Department of Health and a few other groups to do that. I don't have the specific information, but we can provide it to you afterwards. Yeah, thanks.
Hi, thank you. So I know we're looking at overall trends and not hard numbers. Ms. Delcar, you had said in board trainings last week that there's going to be a new evaluation of how you're looking at the metrics. And I know you talked about this a little bit and you answered some other questions. But are we looking at, if we're not looking at a hard number, are we looking at a hard time period for declining trends? I think you said something like 2 weeks.
So most agencies evaluate a trend by a 2-week period of time. That's how we've been evaluating ever since the summer. So when we say we're looking at a trend in declining data, whatever the metric is, 2 weeks has been the standard kind of amount of time we say when we're looking for a trend. That we're not looking at hard and fast data kind of basements or floors, we're looking at ranges. And then how these data metrics kind of influence each other in the ranges and the trends. So it's the direction, how long have they been going that way? It's a more complicated picture. And so that's the thing that we've learned as we engage with other school districts, learn of the other ways other states, other educational institutions evaluate this information is with ranges, directional trends over a period of time.
Can you enlighten us a little bit about what the ranges are?
Sure.
That you guys are looking at?
Sure. So in our talking points, we talked about for positive test rate, we've previously talked about we were wanting to be at 5 or below, 5% positive test rate or below. We are more comfortable with the positive test rate of now 5 to 9 as long as other metrics are trending in the right direction and are low. So our new cases, I think we're also looking at hospitalizations in a way we hadn't looked before because it's another key indicator of how your community is doing. This is all information collected by the City of New Orleans, so it's very accessible to us. For our new cases, You know, we looked at previously 50 being a metric, but I think we're also more comfortable with higher numbers if our positive test rate is lower and stays lower, which is what we're also seeing. So that's why today we say, yes, our positive test rate is very low. It's well below 5, which is fantastic. We want our positive test, our new cases to also kind of trend similarly for a longer period of time when we're more comfortable opening at a higher number of new cases.
Okay. If theoretically that we're still over like 100 or something and everything else was looking good, that'd be acceptable?
Theoretically, yes. Mm-hmm.
Hello. My first question is, I know that you guys have that tracker where you're reporting positive cases among students and staff, but there isn't necessarily a distinction between whether or not the transmission occurred in a classroom setting or outside of schools. Do we have an idea of how many of those 400 some odd cases of those, if any of them, have been transmitted in the classroom setting?
What we do know, since we've been back in school, even though we're in virtual learning right now, except for one school we had that closed for a short period of time, we are not seeing community spread of this virus coming from within our school spreading. This is actually people who are getting it in their community. I'm not sure if there's anything else you want to share.
So anytime we have more than one case of COVID-19 at a singular school site, the school nurse at that site is having conversations with the Louisiana Department of Health to talk about the specific and the uniqueness around each of those individual cases, to talk about, is there a connection? Are there any kind of outbreaks associated? We have those conversations every time there are more than one confirmed positive at a single site. Through those conversations, we rely on the Department of Health to engage and to inform us if they believe there is a connection, and therefore we need to make a closure or a short-term switch to distance learning. The Louisiana Department of Health has never asked us to close a school or move a school to distance learning for a short period of time as a result of those conversations. One time we did decide to do that, even though the Department of Health did not advise us to do so at one of our schools. So how we rely on the knowledge about school, student to student or staff to staff transmission on the school site is through those conversations we have with the Louisiana Department of Health and through the epidemiologists that the Department of Health and the Office of Public Health hires.
Thank you. And my other question might be more suited for Dr. Pasternak. When we talk about the positivity rate, I know there's been some concerns from researchers in terms of how relevant it is to the school community. One of the concerns right now this week is with so many college students coming back into the city and so much mass testing happening in that setting, that might be bringing the positivity rate down. I guess I wanted to ask you how reliable you think this value is when we talk about the schools, and if you guys are potentially looking at, as you get your own surveillance testing up and running, maybe relying on your own internal rates more heavily.
That's a really good question. So that's one of the reasons why we're looking at the trends across things, because different testing or different metrics can have or be influenced by other factors. So you're right that we look at that positivity rate in context, but that's also why, as Ms. Delcourt said, we've been watching that decline, but we want to see those case rates and other things decline. We'll have to see how additional testing factors in as we move forward with those programs.
And just related to surveillance testing of the school community, do you guys have a sense of, how many students and teachers you'd like to see participating in order to have, a reliable value? Obviously, if we have very few people opting into this, then it might not give us a great sense of the situation.
Yeah, I'll let Ms. Delcourt answer that question.
So what we're doing is we're offering testing to our students and staff for asymptomatic testing. We hope that it gets us to a level of surveillance, but it's not specifically surveillance testing.
Thank you.
You're welcome.
Again, we want to just thank everyone for coming to our press conference today and attending it on this afternoon. Please remember, here at NOLA Public Schools, we have been and will continue to keep our community informed through our various ways of communication. As I said before, I know together we're going to get through this, but it's going to be very, very important that each and every one of us understand our part in protecting our community and making sure that we also in this moment are able to get our young people back in school. So again, let's do our part, but also we will end on a note of gratitude because we are seeing the numbers going down and trending in the right direction. And so that says it is working. Let's continue to do it. And this concludes our press conference for this afternoon. Thank you very much.